is a Group 6 reporter. Our topic is gender and health. I will define first the health. Health is refer not only the absence of disease or disability but a complete state of physical, emotional, mental, and social well-being. So dili lang yun siya sa mga kanang absences of mga disease but ga-encompass gid siya sa person nga the state of physical, emotional, and mental. Emphasize that true well-being goes beyond just avoiding illness, includes mental and social factors.
Gender. Gender is socially or culturally constructed between men and women. So, here's a simpler way to understand it. So, ang sex is refer siya into biological differences. So, between males and females such as chromosomes, hormones, o reproductive organs. So, sa gender, ang gender is refer siya sa rules, behaviors, expressions, o identities na ang societies is consider siya sa appropriate sa men of women. And then, gender diverse individuals. These are learned and vary greatly across cultures and time. So, here's our examples of cultural, muna siya ang example sa socially constructed gender differences. So, for example, sa color, in some culture, ang pink is associated lang siya sa girls. And then, ang blue is for boys, di ba? Like anang sa uban nasod, like anang gender reveal. Gender reveal sila, like kung di ba, common naman siya makita na to into sa kanang mga Facebook, sa mga social media nga kanang halos jud sa mag-post ana is common na jud sa like nasod, pero naa jud po na siya dinhi sa tuwa sa Philippines. Like kanang mag-gender reveal sila if ang tunong ana nga color is pink means girl, if blue boy muna sa atoa. For example lang to siya. And then sa toys, ang girls are often given dolls and play kitchen. So common naman siya sa mga girls na ang atoa is kanang mga Barbie doll, like nga na. And then sa boys is kanang ang common pud sa ilaha is kanang panglalaki, like kanang mga tarak-tarak o action figures. Then sa occupation, ang certain jobs are traditional seen as masculine din siya. And then while others are feminine. And then for examples of culturally constructed gender differences. So here are the example, clothing and appearance. Sa hihap, in some mostly sa ilahang cultures is ang women expected na dun sila nga mag-cover sa ilahang buhok o sa ilang body in public. Kay discover po na ko ni siya is sa katong nangaligo. Ang common jud sila is bisan gani maligo is kanang cover jud kay ilang body, as in tanan jud cover kaayo. Kay mo man ni ilahang religious o cultural practice na mag-reflect sa ilang gender norms. And then kimono, in sa Japanese culture, ang kimono is traditionally worn by women. And then symbolizing siya sa femininity and elegance. Next is gender can be seen as the full range of personality traits, attitudes, feelings, values, behaviors, and activities that society ascribes to the two sexes on a differential basis. So, full range of personality traits. So, gender rules often dictate what personality traits are considered masculine or feminine. For example is ang mga lalaki is often expected na dun sila sa mga assertive o strong. Anong mga lugatong mga trabahoon. girls is kanang makaya po nila ang mga bugat bitaw nga trabaho sa lalaki. And then while sa women po is ang expected po sila is to be nurturing, compassionate. Like, ano lang bitaw ta ka ng atong ano lang is sakto lang nga trabaho sa balay, like, gas plato, panglaba, tingnan na bitaw like, basta common na duty siya sa babae. And then attitude toward ourselves, others, and the world are also shaped by gender. For instance, men are often encouraged din sila to be competitive or ambitious, while ang women is encouraged to be cooperative or caring. So, mo dyan na abang mga batasan sa babae sa lalaki. More on competitive yun ang lalaki, and then ang babae is sila sa kanilang pag-care and sa pag-cooperate. Feelings. Societal expectations can be influenced how we express and experience emotions. So, muna man akong gingon na nga, ang men is often discouraged sila from expressing sadness or vulnerability. While ang women po expected to be more emotional, mas emotional jud ang babae. Kaya ang lalaki mong good is the way po sila masakitan na hilo press sa babae nga like inakuan bitaw nila, mas kinadibdib nila ilang emotional nila pag hila-hila, mas more on sharing po ta sa itong mga friends na inanay nga na uban mong good is na po iban lalaki na ginapaagi lang nila sa
My topic is gender, health, and equalities. Women with seeker. Statistically, women are likely to live longer than men, and during their lifetimes, they often experience or more long-term health conditions. This could include chronic diseases like arthritis, autoimmune disorder, and depression. Women are also more likely to report illness or seek medical help, which might contribute to perception. Men die quicker, while men tend to experience fewer chronic conditions in their lifetime. They often have higher rate of mortality from causes such as accident, heart diseases, and violence. Men also tend to have riskier behavior like smoking, drinking. That's why men die quicker than women.
My topic is women's health. Women live longer than men with an average of 5 years longer, but they tend to be sicker than men. And there are 4 factors that determine gender health issue that proves that women live longer than men but sicker than men. First is biological. When we say biological, it deals or refer to our genetic, hormonal, physiological, and immune system factors. Biological is determined to be gender health inequality because women experience many biological health issues. First is women experience hormonal changes throughout their lives. These are menstruation, pregnancy, and menopause. Women also experience reproductive health issues like endometriosis, weak cause are polycystic ovary syndrome and cervical cancer. Women are also prone to UTI or urinary tract infection. Second is social factors. Women are responsible to take caregiving roles for their family, which struggles them to achieve work-life balance because they are focused to take care of their family, which leads to stress, burnout, and mental issues. Women are also likely to experience domestic violence such as sexual assault, and lastly, the worst, cultural expectation. Women prioritize others' needs over their own, and that leads neglect their own health and well-being. The third one is the economical factor. Women are likely to live in poverty because of limited access to education and job opportunities. It means discrimination or gender bias still occurs, which leads to limited access to healthcare, healthy food, and other essential resources. And lastly, the psychological factor. Women are emotional well-being. Women experience high level of stress and anxiety. Women also more likely experience depression and especially mood disorders such as postpartum depression and premenstrual dysphorias. Women also more likely to experience trauma and abuse because of domestic violence, sex assault, and emotional abuse. Women more likely experience autoimmune disease, anxiety, depression, while men, their common lifestyle factor, smoking, alcohol, and drug use, it leads to chronic health conditions and experience higher rate of heart disease, stroke, and diabetes. And one of the reasons why women are more likely to live longer than men because men are more likely to experience high rate of violence, death, and accidents.
Reproductive health issue. So first is menstrual problem. Pinapatong ng irregular period, na painful,
reproductive health issues in women. Pregnancy. In pregnancy, so normal na gid siya ang prenatal care. Regular check-ups o monitoring ang i-monitor ang iyong vital for a healthy pregnancy and well-being of both mother and baby. So, importante jud ang prenatal care kay para manubitaw nila ang vital health sa baby o sa mother. Complication. So, napod siya complication if dili ka magpa-prenatal. Paano siya premature birth. And then, next is HIV or AIDS. HIV transmission. HIV can be transmitted through unprotected sex, sharing needles or from mother to child during pregnancy or breastfeeding. So, ang HIV or AIDS is makuha ninyo siya through like nakipag-sex ka sa lalaki tapos ka na siya ngayon mga sex is na siya sakit so mabalhin sa inyo. So, maybe matakpan ka mo nang ma-encounter ninyo ang sakit ng HIV or AIDS. So, ang treatment niya is ART, which means antiretroviral therapy can effectively manage HIV and maka-prevent siya sa AIDS. Then, allowing po siya sa people na maka-live long and healthy. Next is cancer. In cancer, there are gene ecological cancers. So, this includes cervical cancer, ovarian cancer, uterine cancer, vaginal cancer, and vulvar cancer. So, early detection and treatment are crucial for survival. So, siya? Kaning nga mga cancer is, siya? Delikado yun isa sa itong health. So, mo nang dapat pingin yun ito itong kaugaling para malikayan na itong mga cancer. And then, reproductive health impact in cancer. So, cancer treatments can affect fertility and hormone levels, requiring careful management.